Good morning, everyone. My name is Bea Grouse. I'm the CEO of HANYS, and it's my pleasure to welcome all of you here this morning. You know, this is our first series of policy meetings where we bring together members and healthcare experts around the state to discuss key issues. I think in my way of thinking, healthcare reform is a team sport, so it's about that team building and coming to consensus on important issues, but also healthcare reform is a conversation. And so I hope today will be a conversation between all of us around issues that are most important to us. To kick off our first breakfast forum, we are very fortunate to have a truly extraordinary individual with us this morning, Paul Francis, from Governor Cuomo's Deputy Secretary for Health and Human Services. He is an accomplished, extremely knowledgeable healthcare policy and thought leader, a perfect first start for us. Paul has distinguished himself throughout his varied career in the private and public sectors, including serving 3 governors in top-level positions. He has a deep commitment, as I'm beginning to appreciate, to advancing healthcare for all, and he lives that commitment every day. People and everyone I have talked to respect Paul for his abilities and his accomplishments, but the thing people will tell you about him is that he is truly a joy to work with. So please join me in welcoming Paul Francis.
Well, thank you, and it's a privilege to be here at HANYS, the first speaker in the series of policy forums. You know, since November 8th, the elephant in the room has been what is going to happen in the Trump administration, and we'll make some comments on that. But we know that whatever happens, the underlying challenges that the healthcare system faces did not change on November 9th. And if anything, a tighter fiscal environment that the Trump administration might bring would cause us to accelerate the ongoing strategies that the governor's been pursuing over the last 6 years. Nevertheless, I think the prospect for change that the Trump administration brings is probably more striking as a change in policy direction and underlying philosophy than we've seen for a long time. And it definitely creates some significant risks for the healthcare sector in New York. We're about halfway through the 6-year DSRIP process. This is a very ambitious program. It's intended to be a catalyst for broader change within the state. It is not even $7 billion over 5 years in the context of a $150 to almost $200 billion healthcare system in New York is not going to single-handedly change the way healthcare is delivered, but it is providing a roadmap, I think, to other payment streams that can significantly help change the way healthcare is delivered. At the midpoint assessment, which was announced last month, there were 4 PPSs that were sufficiently on track that no corrective action plan was required. 21 PPSs did have recommendations to have a corrective action plan in some way. DSRIP is not exactly letting 1,000 flowers bloom, but it is letting 25 flowers bloom. And I think we have the ability, as we watch the success of particular PPSs, to learn what works and what doesn't work. And as the program reaches a conclusion, we'll be able to scale those things that are working and address those that aren't. All the PPSs were seen as being on track with their projects, and those projects now are becoming visible to people, making more clear what DSRIP really is all about. DSRIP is trying to do many things, but one of the things it's trying to do is to focus on non-clinical interventions that can help to make people healthier. By 2018, every PPS will have to have one contract with a non-Medicaid financed community-based organization, one social determinant of health that they're trying to address, and many of the PPSs are taking aggressive action across a number of these fronts. So we're doing quite a lot in New York. I agree with Bea. I hope this is a conversation. Be delighted to take any questions and continue this conversation. Thank you very much.